Is your penis less sensitive than it used to be? Maybe sex doesn't feel as intense as it once did. Maybe orgasms feel muted. Maybe you need more stimulation to get there. If any of that sounds familiar, you are not alone. And more importantly, it is not permanent. I'm Dr. Emma Blake, urologist and pelvic surgeon, and today I'm going to walk you through exactly what causes reduced penile sensitivity, what the science says about reversing it, and the specific things you can start doing right now to get that sensation back. And make sure you stick around till the end, because I'm going to share one technique that most men have never heard of, and the research behind it is genuinely surprising. So first, let's talk about why sensitivity decreases in the first place. The penis is packed with nerve endings, specifically a type called Meissner's corpuscles. These are the nerve receptors responsible for light touch and fine sensation. And research shows that the density of these nerve endings actually decreases with age. But here's the thing, age is not the only reason this happens. And in many men, it's not even the main reason. There are three big factors that quietly steal sensitivity over time. Number one is something researchers call high friction desensitization. This is essentially what happens when the penis is repeatedly exposed to high levels of pressure and friction without adequate lubrication, whether that's from aggressive masturbation, a very tight grip, or prolonged intercourse without enough natural lubrication. Over time, the skin adapts. It actually thickens slightly in response to that friction, the same way the skin on your hands toughens when you do a lot of manual work. And that thickening reduces the quality of sensation reaching those nerve endings underneath. Number two is reduced blood flow. Sensation and blood flow are deeply connected. When blood flow to the penis is compromised due to cardiovascular issues, high blood pressure, diabetes, or even chronic sitting, the nerve tissue in the penis gets less oxygen and fewer nutrients. And nerve tissue that is chronically undernourished starts to lose function. This is actually one of the earliest signs of vascular disease that shows up in the penis before it shows up anywhere else in the body. Number three is hormonal decline. Testosterone plays a direct role in maintaining the sensitivity and health of penile nerve tissue. As testosterone levels drop, which starts happening gradually after the age of 30, men often notice a slow but real reduction in how intensely they experience sexual sensation. Now here is the good news. All three of these factors are addressable. Let me walk you through what the research actually supports, starting with desensitization from friction. The fix here is straightforward but requires consistency. First, if you are someone who uses a very firm grip during masturbation, you need to consciously retrain that. Researchers call this breaking the death grip pattern. By switching to a much lighter touch and incorporating lubrication, you give the skin time to return to a more sensitive baseline. Most men who do this consistently report noticeable improvement in sensitivity within 4 to 6 weeks. Now let's talk about blood flow, because this one has some of the most interesting research behind it. A 2011 study published in the Journal of Sexual Medicine found that men who did regular aerobic exercise, specifically 40 minutes of moderate to vigorous cardio 4 times per week, saw significant improvements in erectile function and penile sensitivity within 6 months. The mechanism is simple. Better cardiovascular health means better blood flow. Better blood flow means better nourishment of nerve tissue. And better nourishment means sharper, more intense sensation. But here's the technique I promised you at the beginning, and this one surprises most people. Pelvic floor training. Yes, the same exercises that we prescribe for women after childbirth. A 2019 study found that men who completed a 12-week pelvic floor muscle training program reported significantly enhanced orgasm intensity and penile sensitivity. The reason is that the pelvic floor muscles are directly connected to the neurovascular bundle that supplies the penis. When those muscles are stronger and more coordinated, they enhance blood flow during arousal and heighten the nerve signal intensity during stimulation. Men in that study described orgasms as feeling more whole body and more powerful than before. Here is how to do it. Sit or lie down comfortably. Contract the muscles you would use to stop the flow of urine. Hold that contraction for 5 seconds. Then, fully relax for 5 seconds. That is 1 rep. Do 10 reps 3 times a day. After 4 weeks, increase to 10-second holds. Most men start noticing a difference by week 6. And then there is testosterone. If you are experiencing significant sensitivity loss and you are over 40, it is worth getting your testosterone levels checked. Low testosterone is incredibly common and incredibly underdiagnosed. And when it is addressed, whether through lifestyle changes or medical treatment, many men report a meaningful return of sexual sensation. So to bring this all together, yes, you can increase penile sensitivity. It is not something you just have to accept as inevitable. Address the friction issue, prioritize cardiovascular health, train your pelvic floor, and get your hormones checked. These are not complicated things, but they work, and the research backs them up. I want you to remember that your sexual health is a reflection of your overall health. Taking care of one means taking care of the other. If you found this helpful, make sure you subscribe and share this with someone who needs to hear it. And as always, take care of yourself, because you are worth it.